May we move on now to item 6, which is the design and designation of academic health science networks, and I'll invite Bruce Keogh to introduce the paper.
Thank you, Chairman. Many of the details are outlined in the paper. What I'd like to do is introduce it with some context. So England has got the largest integrated healthcare system in the world. It's got 4 of the top 10 universities in the world. In the United Kingdom, we have more Nobel Prize winners than any other country apart from the United States, particularly in medicine and physiology. We're responsible for 14 of the world's top 75 drugs, and we've got a pretty vigorous medical technology industry. So against that background, we should be able to spread new ideas quickly throughout our healthcare system to the benefit of patients. But we haven't done that as effectively as we could in the past. And so we don't bring that benefit to patients, and much of it is exported. There have been a number of strategies in the past which have been designed to try and address this, but they haven't really bitten. But I think the turning point came when Aradazi published his review in 2008, where he recommended the designation of specific academic health science centers and the development of things that were called health innovation and education clusters, which were meant to bring together industry, educators, and academics. Now, UCL Partners took that a step further through a cultural and structural change based on the very successful model which is used by the Harvard group of hospitals in Boston, which integrated the previous academic health science centers and the health and innovation clusters, and brought in additional providers of healthcare. And now we have 5 of those partnership models throughout England, but they're quite exclusive and they don't cover the whole country. So as part of trying to address the problem of diffusion, David Nicholson asked Sri and Carruthers to conduct a review which was published and is called Innovation, Health and Wealth, which tries to address the issues and the barriers to systematic diffusion and spread of science, technology, and new ideas. And as a consequence of that, the concept of the Academic Health Science Network, based very much on the UCL Partners model, was announced as part of the Prime Minister's Life Science strategy. And the idea there is to align education, research, informatics, training, delivery, and an association with strategic and delivery networks to improve the health outcomes of patients and the population at large by translating research into practice within those regions. The idea is that the academic health science networks will be owned by their constituent members, which will include both providers and commissioners and others, and that those networks will work closely with industry, local authority, and the emerging clinical senates. So it seems to me that this is a unique opportunity for industry to engage with our NHS, which will bring a number of advantages at different levels. In order to make this happen, we're going through a designation process at the moment, which runs between the 3rd of this month and the 18th of February. We've designated 4 so far. We're aiming to designate 15 academic health science networks. As part of the designation process, they have to set out a 5-year strategy. They have to demonstrate how they're going to propagate much greater levels of compliance with NICE technology appraisals, and also how they're going to work with small and medium enterprises on medical technology projects. And of course, as part of trying to encourage this to happen, we intend to put some financial incentives out there, and the funding for that will be considered earlier in the new year when we address some of our funding pressures. Thank you.
Thank you. Margaret.
Thank you for your paper. I thought it was really exciting, and I'm looking forward in a few years' time to not hearing about Silicon Valley in the States, but sort of clinical valley or something. It's exciting that describes what is coming forward from our own initiative. It's excellent. I think one of the things that would be really helpful to both in terms of helping to escalate the excitement and also the standards, but also to help us in our oversight of just the progress, would be if the networks, once you've got the designations established, is the network could build in a system of peer review that we could then look at to understand progress and how that's moving forward. So in other words, we're relying on the skills of others rather than we ourselves having to try to ascertain what progress is being made and how it's growing.
Thank you very much, Margaret. That's a good idea.
Maybe take some other comments as well, Bruce. Could I just ask you... Oh, sorry, Kieran, after you.
Thanks, Malcolm. It's just an encouragement to be as ambitious as possible. I think one of the great things we have, because of the size of the system, as you describe, is great population evidence. If only we understood it and analysed it and looked at it and looked at the opportunities that could come out of that. So it's making sure that it's not only, it obviously clearly must be a huge priority to have the biology bit right, but also the technology bit, but also the population evidence side as well. And that bringing together, I think, will have huge opportunities. So applaud the ambition and would encourage more of it.
Tim.
Just Bruce, reflecting on my background a bit as an entrepreneur, I just would really encourage, I think it's fantastic if we can use this initiative to really try and unlock the potential that entrepreneurs in this country offer us, and to my mind we have not adequately kind of exploited on behalf of patients. I think there are lots of things that currently obstruct SMEs playing a kind of vital role that they should be playing in the future, but I'd be incredibly supportive of anything the board can do as part of its core legacy, core ambition to unlock the power of SMEs in driving innovation for patients.
And could I just raise the question of geographical alignment? I mean, what we need to try to ensure is we've got the greatest simplicity of structures. And your paper refers to the alignment with clinical senates, and I think also local education and training boards. Are we going to be able to achieve a sort of perfect alignment so that we don't have awkward areas of overlap and confusion of functions?
I think broadly speaking, the answer to that is yes. But there will be some small areas of overlap at the edges. But on the whole, there will be some larger areas and smaller ones, and the smaller ones will nest within the geographical boundaries of the larger areas. There will be some small areas of crossover which have, I think, been defined largely by complexities of patient flows.
Oh, I see. Thank you.
Can I just very quick, I mean, massively warmly welcome this, and I do think that the way in which you bring this ecosystem together is really important and exciting. I couldn't quite see any specific reference to the way in which the third sector would be embraced in these. Is it the intent?
Yes, indeed, it is the intent to involve the third sector, and in other areas that we're considering, particularly around the how we develop the improvement body for the NHS, we see the third sector as very powerful allies and even delivery partners. Now, I have a declared interest here, as I'm on the council of the British Heart Foundation, which is one of the big charities. I believe there are a series of things that the third sector can bring. Firstly, they understand what patients want in a way that many NHS organisations don't. Secondly, many of the bigger organisations conduct very constructive and innovative research, which is both at a delivery level and at a scientific level. And thirdly, they're trusted by the population that they serve. So I think if we were to leave out the third sector, we would do so at our peril.
Well, thank you, Bruce. I think you've heard very warm endorsement, indeed enthusiasm around the table for the venture. I mean, I think of enormous importance not just for the NHS, and our responsibility here is to put patients right at the heart of this, and to be able to draw upon the brilliant science that exists in our university and the strength of the industrial sector in the UK. But it also has, I think, very significant implications for universities and opportunities for universities in engaging much more closely with the NHS. It's almost as if in history there have been two quite separate organisations, albeit that the universities provide the training and the education for the future provision of clinical services across the NHS. And I think to be able to draw them together in this way, which is a strategic and informal way driven by local leadership, is a very powerful potential lever for change. So thank you for the paper, and we look forward to following progress over future months and years.